2021 marks the 35th year of Street Health providing harm reduction and healthcare services at Sherbourne and Dundas in downtown Toronto. Street Health works to improve the health and well-being of people who are homeless, underhoused, and street involved. Many of our clients struggle with mental health and substance use issues. Our approach is low barrier, client-centered, accessible, and community-based. Our history and the range of services provided mean that Street Health's story includes many voices. This includes the voices of registered nurses and nurse practitioners who provide nursing clinics on a weekly drop-in basis.
Even during challenging time, like the COVID pandemic, Street Health's nursing clinics continue. We're seeing an increased need for crisis care and wound care, as this pandemic takes an incredible toll on those who are marginalized.
During COVID, while we have suspended food care and drop-ins, these are vital services. Now, drop-ins are beginning in accordance with public health.
There are the voices of mental health workers who provide intensive support to clients to improve and maintain their mental health.
Mental health services continued throughout last year, helping clients address evolving needs such as support for virtual justice system, appointments, and supporting clients who are among the many who lack secure housing and face evictions.
There are the voices of identification workers who help clients apply for and keep their ID and mail in safe storage.
With many community-based clinics canceled during COVID, Street Health continues to offer support through a weekly drop-in ID clinic and one-on-one support. The ID safe continues to be open each weekday and is regularly used by over 500 individuals.
There are the voices of our harm reduction team who promote harm reduction as the best approach to help people who need to use substances safely and are experiencing homelessness. These voices include staff and volunteers who bring the expertise and connections of lived experience.
Street Health was among the first organizations to demonstrate how those with lived experience bring in an insight and an essential voice to shape the services provided.
To be truly client-centered, Street Health values and takes our lead from those with first-hand knowledge of the issues and needs of those we serve.
There are the voices of health bus outreach workers who take information and case management out into the community to ensure services are available.
Street Health works in partnership to bring services out to the community in the evenings and weekends.
In the age of COVID, supports for those who have been moved into hotels and those who are surviving in encampments are a focus of outreach.
There are the voices of our overdose prevention site, which government defunding attempted to silence.
2020 has been the most deadly overdose year to date. The conditions required in efforts to control the COVID pandemic have isolated many people who rely on OPS and safe consumption services.
We must maintain services that provide supports and create options for healthcare services for those who use substances.
Each of us need to add our voice to end this crisis.
There is the growing Voices of Safe Supply, a program which brings a new approach to supporting those who struggle with their reliance on a toxic drug supply.
Safer opioid supply is targeting people who are at elevated risk of overdose.
These are clients who previously may have spent $2,000 to $5,000 each month on contaminated street drugs.
The program helps people reduce or eliminate the stress and risk of their reliance on drugs of an unknown strength and quality.
And there are the voices of frontline staff who daily ensure our clients have access to health promoting supplies, offer connections, information, and referrals for a population that does not have access to technology and relies on face-to-face contact.
And now, in the age of COVID, these are the voices of screeners who provide clients with personal care, hygiene, and seasonal items. If you have been past Street Health recently, you will see the addition of a trailer to the front of our location to enable us to safely and accessibly continue to provide services to over 150 individuals each day.
All of these services are at Street Health.
Where and when clients need them.
Without stigma.
with no discrimination
and no judgment
and no barriers.
Reducing the harms caused by homelessness is what Street Health has been doing for 35 years. Thanks to all of our friends, advocates, funders, donors, and volunteers who make this work possible.